This video is the fifth in a series about headaches. My previous videos were about migraine, cluster headaches, trigeminal neuralgia, and tension type headaches. Today, I'll talk about cervicogenic headaches. Cervical means to the neck. Cervicogenic means that the headache has originated in the neck. The sensations from the head and neck are linked, and pain in one area can be felt in the other area. This is called referred pain. When the person has a problem in the neck, the pain can refer to the head and vice versa. So, let's talk about cervicogenic headaches today. I made this video series in collaboration with Migraine Canada. If you want to learn more about headaches and migraines, visit their website. They have a lot of resources, events, and education materials for you to learn more about migraines. We learned in the previous videos that there are primary and secondary headaches. Primary headaches are when the headache is the disease itself. Secondary type headaches are when they are symptoms of another condition. Migraines and cluster headaches and tension type headaches are all examples of primary type headaches. Trigeminal neuralgia and cervicogenic headaches are examples of secondary type headaches. Cervicogenic headache affects between 1 and 4% of the general population. Cervicogenic headache can be isolated, but they can affect people with other headaches, especially migraines. A migraine can lead to a bad posture that will lead to a compression of a nerve in the neck and start a cervicogenic headache. This is what we call the migraine ping-pong theory. Many cervicogenic headaches start after a trauma to the neck, like in a car accident, where the neck moves quickly to the front and backwards. This is known as a whiplash injury. This type of post-traumatic headache may have all features of a cervicogenic headache. The diagnosis of cervicogenic headache is basically by doing the treatment in the neck and observing if the headache improves or not. If the neck treatment eliminated the headache, it was cervicogenic headache. The symptoms of cervicogenic headaches include both neck and head pain, and the pain is aggravated by some movements, posture of the neck, or maneuvers to provoke pressure on the neck structures. We have to treat the neck to alleviate the headache. And the types of treatments include a variety of approaches for the muscles, facet joints, bones, discs, and nerves. Before I continue, let me remind you that this video is not intended to replace medical advice. It is for educational purposes only. Please talk to your doctor about the diagnosis and treatment plan for you. And in case of an emergency, please go to the nearest emergency department or call an ambulance. To treat the neck, remember the toolbox of treatments. I use the letters 5MIS, which means mind, movement, manual, modalities, medications, interventional, and surgery. When the origin of the pain is in the muscles, I recommend mind-body relaxation and SSAR exercises. These muscles usually have myofascial pain, and the exercises include a mix of stretching, strengthening, aerobics, and relaxation exercises. Watch my other video about SSAR exercises for myofascial pain of the neck. I also recommend modalities like heat, cold, TENS, dry needling. Self-massage can be very helpful, especially for the sternocleidomastoid and upper trapezius muscles. I perform trigger point injections when exercises and self-massage and modalities do not resolve myofascial pain. Sometimes I prescribe amitriptyline or muscle relaxants. When the origin of the pain is in the nerves exiting the neck, I recommend nerve blocks, like the occipital nerve block on the base of the occipital bone. In some cases, I send the patient to an interventional pain doctor to do a diagnostic test on the C2, C3 blocks to see if the headache gets better. Occasionally, I recommend botulinum toxin injections to treat both chronic migraines and the cervicogenic headache. I don't recommend opioids as the risk of dependence, addiction, and medication overuse headaches or MOH is very high. You may use a headache diary to track your symptoms, and Migraine Canada has a version that you can download and an app version. If you like this video, give your thumbs up here and don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos. Thank you for watching today. Goodbye!